Disclaimer: We Level Up is not promoting the use of buprenorphine. This video explores dangers and consequences, not endorsement. Learn, don't use. Comment below. Stay safe. Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: what is Subutex, buprenorphine? The brand name Subutex medication treats opioid addiction or opioid use disorder, OUD. It contains the active ingredient buprenorphine, which is a partial opioid agonist. This means that it can activate the same receptors in the brain as other opioids, but to a lesser extent, helping to reduce cravings and opioid withdrawal symptoms. Subutex is taken as a sublingual tablet placed under the tongue to dissolve. While Subutex can be effective in treating opioid addiction, it can also cause side effects and has the potential for abuse and addiction. It should only be taken as directed by a healthcare provider who is licensed to prescribe it. How does Subutex pill works? Subutex contains the active ingredient buprenorphine, which is a partial opioid agonist. As a partial agonist, buprenorphine binds to the same opioid receptors in the brain as full agonist opioids, e.g., heroin or oxycodone, but produces a less intense effect. This binding helps alleviate opioid withdrawal symptoms and cravings without causing the same level of euphoria or respiratory depression seen with full agonists. Moreover, buprenorphine's high binding affinity to the opioid receptors can displace other full agonist opioids, preventing their effects and reducing the risk of overdose. Subutex medication for opioid use disorder. Subutex is a medication used to treat opioid use disorder, OUD. As a part of medication-assisted treatment, MAT, buprenorphine helps alleviate withdrawal symptoms and cravings, allowing individuals to stabilize their lives and work towards recovery from opioid addiction with appropriate medical and psychosocial support. Buprenorphine Subutex warnings. Buprenorphine, the active ingredient in Subutex, is a potent medication for treating opioid use disorder, OUD. While it is an effective and valuable treatment option, it comes with some warnings and precautions. Addiction and dependence. Buprenorphine is an opioid, and like other opioids, it has the potential for abuse, addiction, and physical dependence. Respiratory depression. Buprenorphine can cause respiratory depression, especially when taken in higher doses or combined with other central nervous system depressants such as alcohol or benzodiazepines. Risk of overdose. Taking buprenorphine in excessive amounts can lead to overdose, which can be life-threatening. Combining it with other opioids or drugs can also increase the risk of overdose. Pregnancy and breastfeeding. Buprenorphine use during pregnancy can cause neonatal withdrawal syndrome in the newborn. Pregnant or breastfeeding individuals should consult their healthcare provider for appropriate buprenorphine pregnancy management and treatment options. Interactions with other medications. Buprenorphine may interact with certain medications, including other opioids and central nervous system depressants. Liver function. Buprenorphine is metabolized in the liver, so individuals with severe liver impairment should use it cautiously. Allergic reactions. Some individuals may experience allergic reactions to buprenorphine, such as skin rash, itching, swelling, severe dizziness, or difficulty breathing. Seek immediate medical attention if any signs of an allergic reaction occur. Before taking Subutex dosage. How to take Subutex correctly. Before taking Subutex, buprenorphine, it is essential to consider the following. Talk to your doctor about your medical history, current medications, and any medical conditions you may have to ensure buprenorphine is the appropriate treatment for you. If you are pregnant, planning to become pregnant, or breastfeeding, inform your healthcare provider. They will weigh the risks and benefits of buprenorphine during pregnancy and breastfeeding. Inform your doctor about any known allergies, especially to buprenorphine or naloxone, if considering Suboxone, which contains naloxone. Inform your healthcare provider about all your medications, including prescription, over-the-counter medications, vitamins, and herbal supplements. Some medications may interact with buprenorphine, affecting its efficacy or safety. Inform your doctor about liver or kidney problems, as buprenorphine metabolism occurs in the liver. Adjustments to the dosage may be necessary in case of liver or kidney impairment. Be open and honest about any other substances you use, including alcohol or illicit drugs. Understand the potential side effects of Subutex, which may include dizziness, constipation, headache, or sleep disturbances. Your doctor can provide you with more information about managing these side effects. Follow your doctor's prescribed dosage and administration instructions carefully. Do not change the dosage or stop taking buprenorphine without consulting your healthcare provider. What to do if you miss a dose or overdose on Subutex? If you miss a dose, take it as soon as possible. However, skip the missed dose if it's close to your next scheduled dose. Do not double up on doses. Act quickly in the event of an overdose. Seek immediate medical help or dial the poison helpline right away at 1-800-222-1222. Using buprenorphine without a prescription, especially in children, can have serious, potentially fatal consequences. Symptoms of an overdose may include extreme drowsiness or weakness, cold or clammy skin, pinpoint pupils, slow heart rate, weak pulse, prolonged breathing, or coma. Precautions to take while using Subutex sublingually. Refrain from consuming alcohol, which can lead to dangerous side effects or even death. Avoid driving or operating machinery until you understand how buprenorphine affects you. Dizziness or drowsiness can cause accidents, falls, or severe injuries. Subutex side effects. Immediate action is necessary if you experience an allergic reaction, such as hives, difficulty breathing, facial swelling. Opioid medication can significantly impact your breathing, potentially leading to death. If someone notices your breathing slowing down, your lips turning blue, or you cannot be roused, seek emergency medical assistance. Contact your doctor immediately if you notice any of the following Subutex side effects. Dental or gum issues. Noisy, shallow, or interrupted breathing, especially during sleep. Problems with cognition, vision, speech, or feeling lightheaded. Chest pain, difficulty breathing, or a slow heartbeat. Withdrawal symptoms such as shivering, sweating, or muscle pain. Low cortisol levels, vomiting, dizziness, increased fatigue or weakness. Liver problems, nausea, stomach pain, jaundice, or changes in bathroom habits. Subutex Detox Program. If you or someone you care about is exhibiting any of these signs or symptoms, seeking help from an addiction treatment specialist is essential. Buprenorphine abuse can lead to addiction and other adverse health outcomes, but recovery is possible with the proper treatment and support. Can you get high on Subutex? Like any opioid, if buprenorphine is misused or taken in higher doses than prescribed, it can still produce euphoric effects and may be abused. The signs and symptoms of Subutex abuse can include the following: taking higher doses than prescribed, using buprenorphine more frequently than prescribed, crushing, snorting, or injecting Subutex, seeking buprenorphine from multiple healthcare providers. Continue using buprenorphine even when it's no longer needed for medical purposes. Spending a lot of time thinking about buprenorphine or obtaining it. Neglecting responsibilities at home, school, or work due to buprenorphine use. Experiencing withdrawal symptoms when not using buprenorphine. Engaging in risky behaviors while under the influence of buprenorphine, such as driving or operating heavy machinery. Using buprenorphine despite harmful consequences to personal relationships, finances, or legal problems. Suboxone Detox can help you to safely discontinue the use of buprenorphine under the supervision of a healthcare professional. Detoxification is typically done gradually through a tapering process, where the dosage of Suboxone is reduced slowly to minimize withdrawal symptoms. A well-managed Suboxone detox can help individuals transition from medication-assisted treatment to abstinence. Still, it should be done under medical guidance to ensure a safe and comfortable process. Contact We Level Up New Jersey to get started. We can help you explore and discuss weaning off Subutex and live a drug-free life. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.